So, hello everyone. I'm so delighted you accepted the invitation and share with us this space of inspiration and growth for homeopathy. In a world where human health is increasingly being challenged and healthy systems that seek deeper balance are also evolving. In recent years, we have continued to observe both scientific and practical progress in homeopathy. But parallelly with the evil, the goodness also going stronger. This is a cosmic law. The theme of the event is peace and love within with homeopathy. Because when we find this peace within ourselves, it naturally begins to manifest in the world. And homeopathy as a holistic approach to the human being has a great potential to support this inner balance from which this peace and love arise. Our first speaker is Patricia Hatherly. She has been in private practice as a homeopath since 1995 and is well-known colleague and homeopath all over the world. She is from Australia, and her special area of interest is working with lax as a kingdom. She was for 20 years a clinical supervisor and lecturer in materia medica at the campuses of all the natural therapies educational institutions in Brisbane, which offered homeopathic subjects and has taught extensively throughout Australia and overseas. But she is particularly fierce advocate of babies and mothers, and she has dedicated 50 years of her life, for empowering mothers and babies in their natural growth and upbringing and care and feeding. She is ex-president of Australian Homeopathic Association, and I can speak a lot about her, but I would prefer to tell you a short story. This is a Roman story. There is an old Roman legend about two noble women. One of them was wealthy and proud of her riches, while the other was poor. One day, the rich woman invited the poor one to show her jewels and then, with a hint of irony, asked her to show her own. The second woman whispered something to a servant, who soon returned with two handsome young boys. "These are my jewels," she said. And the rich woman kept silent. So, in the age of in vitro fertilization and increasingly technological childbirth, it is more than ever important to preserve what is human and healthy in our children. So the mission of Patricia Hatherly is very important. That's why I support her, and she will be part of our events, who are dedicated not only to soothe people and to spread awareness about homeopathy, but about everything that supports humanity at all, and our health, and peace and love from within. So
Lovely words.
I'm looking forward to hear your lecture, Patricia. If you can say more about yourself, you can read more about her in her website.
That's enough. That's enough. Let's get started. So As was just said to you then, yes, it's we're living in very strange times now. In Australia, 1 in 18 babies are made in a petri dish, and over 50% of babies are born by cesarean section now in England, and breastfeeding rates have really dropped. So, we mothers need a lot of support, families need a lot of support, and so that's what I'm going to be sharing with you this evening. The first half, I'm going to look at a little bit of the reasons why that's important, and then the second half is going to be based on a lot of practical things to help. And we can do a Q&A if there's time. So, we make the saying that breast is best. So why is that? Well, it's because it's species specific. That is, human milk is designed for healthy human babies. And all the other milks from all the other mammals are tailor-made for their particular infants. And when you look at this grid here, which is in my book on the lacs, these are all of the milks that we have provings for. And you look here at human milk, you can see that it's more than 85% water. It's quite a lot of fat in it if the mother's diet's good, but it's very low in protein, but high in lactose. And if we're going to give formula to a baby, normally it's cow's milk, and it's got 4 times the protein and nearly half the lactose, so it's not really suitable. The milk of the donkey is more suitable in some ways, although it's got a lot of barium in it, which makes it not good really for humans. And interestingly, the materia medica of lac acinum is very like that of lac humanum, which is very interesting. And if you just look down here at the seal and the whale, look at the amount of fat that's in those milks because of the climate that they're in. So this species specific milk is something that's very important. And there's nothing that can really replace a mother's milk for her baby. Cow's milk has got a lot of basic nutriments in it, a lot of vitamins, a lot of minerals. Uh, this is a billboard that came from Canada. They were having a big promotion of promoting dairy when I was over there teaching quite a few years ago, and I asked them, could I have a copy of it? Because I thought it was very interesting and ironic, really, because when you compare it to human milk, this is a poster that sits in my clinic. I mean, this is your what's in formula. And I know you can't read this, but the visuals give you the impact. This is what is in human milk. And most of that is in the whey protein. Our milk is 60% whey. And that's where all the immunoglobulins are and all the really good things that make the baby really, really healthy. So we want to keep in mind that when a baby is born, it's still being gestated. And I want that to be the takeaway message tonight because the mother is still growing the baby's brain, still developing the baby's immunological system. So, all the immunological competence that was in the mother going through the placenta continues through her milk. And that's first 1,000 days, we say, are very critical for this to continue. And that's because there are innumerable hundreds and thousands of particular molecules that, promote uh, good, healthy milk, reduce inflammation, protect against infection, and help to develop the immune system, all the organs, and especially the gut, the microbes in the gut. The microbiota now is something that's been very well investigated, and we're realizing more and more how important that is. So Niels Bergman is a pediatrician from South Africa who's done a lot of work in the kangaroo mother care situation where really preemie babies are actually, grown on their mother's chest. And he says that the mother infant dyad is still a single psychobiological organism. So we need to keep that in mind. The world of the fetus is the womb and the mother who surrounds it. And so the experience for the baby is consistent, it's contained, and it's familiar, especially the sound of her voice. So a baby, when it's born, cannot exist alone. The baby is still part of the relationship. We have to remind ourselves that, when a baby's born, a mother is also born, and they're still very, very much linked. So human babies are quite helpless at birth, and that's because they're neurologically immature. And so this skin-to-skin contact and breastfeeding help mature the baby in that particular sense of the immune system and the neurological system. So, as I said, gestation continues outside the womb, and that's especially important if the baby is premature. So, cuddling is really important. It helps to build the brain. Every stage of the development, is an ongoing building on what has come before. And that the first 1,000 days, nothing can replace what goes on in that time. So the first thing we need to focus on is the development of the amygdala. And that very much relies on sensory input, especially touch, the first couple of months. It's very critical for the development of the amygdala. And so we've got skin to skin contact, whether the baby's awake or asleep. It sends nerve impulses to the baby's brain and it activates the amygdala through the prefrontal orbital pathway. And the mother's voice also is very important at that time. We know from research that it promotes early vocalization and language development later on. And we know from research that a baby's brain responds to rhythm and melody and familiar voices long before birth. So what we understand is that there's early neurological organization and emotional readiness. Singing during pregnancy is more than a soothing habit. It's something that's to be promoted if possible. Baby's not going to care if you haven't got a good voice, just likes to hear your voice. Sound travels when the baby's in the womb. So when the parent sings, the baby's nervous system gets into rhythm with that and it feels comforted and it feels safe. It's familiar. So we know that from studies that linking prenatal singing improves the mood after birth, and babies exposed to regular singing are much calmer, they are more attentive, and that's because the early auditory experiences help to shape the emotional circuits. And we know that from research that 81% of newborns, heal quicker if they play music, particularly, really lovely soft music in the first 5 days of life. Heart rate drops and oxygen levels rise. So classical music is to be considered in the nursery. And just mums singing to babies. I mean, a lullaby is something that the baby will really enjoy because the auditory system is stimulated by music and that promotes relaxation and cognitive development. The impact is immediately and long lasting. So it really helps to shape brain development in very subtle ways, but meaningful ways. And so if parents use soft rhythmic music or lullabies, they're very supportive of their baby's healing and growth. And it can create a calm environment. It strengthens the connection between the mother and the baby. Early stimulation, and all of this is promoting resilience, emotional regulation, and healthy development. And so what we're getting here is the connections of the synapses and the functional brain circuits are being developed in a way that's very positive, and the baby is able to learn to self-soothe, which is another, common term that we would use for saying that they're able to self-regulate. So some important things to consider here is that when the baby's born, a human baby, its brain is only 25% of its final size. I mean, if the baby was left in the womb till the brain was fully mature, it would never come out the birth canal because that doesn't happen till they're 3. So at 12 months of age, it's still only 80% developed. A primate, a monkey or an ape or a chimp at birth, their brains are actually 80% developed at birth. So there's a really big difference there. That's why they are more capable and they can hang on to their mother. Our babies are quite useless. They need a nest, and that nest needs to be at the mother's breast. So we know that there are certain things in the milk that help the brain develop. There's choline, the sialic acid, and in particular the long-chain polyunsaturated acids. They're very important. So having fish in the diet, fish oils are very important. I just want to show you this study. It came out just 12 months ago in May. This is a study that looked at teenagers, and they found that extended breastfeeding promoted optimal adolescent neurocognition if they were fed for 2 years. So they found that for later on in life, these teenagers were going to have a better chance to have a successful life. So there's more cortical thickness, a greater surface area, better development of the myelin in the brain. So it was a very in-depth peer review study. And so, one of the gold standard. And that kind of corresponds to the Brazil study that I like to talk about, where babies were followed up for 30 years, thousands of them, and they found every marker they had a much successful, happier, productive, wealthy life. Yeah. So lots of studies about development of the brain and human milk that cannot be denied. There's nothing to replace it. So I've chosen this meme. I know it's CGI, but because it just kind of looks a little bit like a breast, so I'm trying to get the message over that the breast takes over the role of the placenta. And so the baby benefits from all that the mother's bloodstream is able to provide in terms of nutriment and immunoglobulins. And so when the baby's born, that just switches to what the breast can provide. And so the breast milk, which of course is made from the mother's blood, with contribution from her diet, particularly the kind of fats that she has in her diet. So that just takes over. So instead of the umbilicus, feeding the system, it's the baby's mouth that'll feed the system. So this is another obviously CGI meme, saying that breast milk is like gold, and it is in lots of ways. I call it the white gold of the alchemists because a baby is very immature and primitive in lots of ways and needs a sublimating process, and it's the milk that's going to provide that. But then, of course, colostrum really is a golden color. And so, it's not such a stretch really when you think about it. And it's the mother's first precious gift. 3 days of just colostrum, and then there's another couple of weeks where you've got what's called transitional milk, and then the true milk kicks in at about week 3, and that's when they're going to get colic if it's going to be a problem. We'll talk a bit about that. So it's yellow, and that's because of the beta carotene. There's lots of sodium, magnesium, chloride, potassium, and sulfur. They're much higher in colostrum than they are in mature milk. And the calcium and the phosphorus are lower in the colostrum. There's lots of fat-soluble vitamins and minerals, more so in colostrum than there is in mature milk. And it's much higher in protein by a factor of 3. Can go 20% higher again when baby is born preterm. So the protein content of colostrum goes up to nearly 100% actually. It's this amazing substance. So what fat is present tends to be of the 18-chain variety, and that's derived from extramammary sources. So it's important for the mother to have a good range of different fats in her diet at term. So lots of immunoglobulins, especially secretory IgA. It's actually 3 times higher than in mature milk. And then even so, in mature milk, secretory IgA is 5 times higher than it is in serum. That's why the oral mucosa is very protected because of this. So babies don't get viruses and they're not susceptible to bacteria. It's very protective. And I will talk a little bit more about that when I talk about RSV. It's rich in antibodies, provides protection against bacterial and viral exposure that's going to occur during birth as the baby comes down the birth canal and onto the perineum. It's exposed to a lot of bacteria, and that's important actually for the baby to be seated with that and then to be put on the mother's stomach and to wriggle around and get all the bacteria that's on her skin, and then go looking for the breast. So that will colonize the gut, and that's important that it's the mother's bacteria that does that. So the whey fraction in protein can go as high as 90% in the first days. So the emphasis is on protection. So there are lots of membrane components such as phospholipids, cholesterol. Now, we think that cholesterol is synthesized in the mammary gland, and it's really important for brain tissue development. And the brain and, of course, the spinal cord are protected by myelin that's mostly made from cholesterol. In fact, most hormones are made from cholesterol. It's been made out to be a baddie in the last, 20, 30 years, but in fact, cholesterol needs to sit around about 4 in order to protect against cancer. And there were some studies done in rats. So it showed that when, the little ones were exposed to high levels early in life, it was able to establish a set point in the metabolism. And so they were able to maintain their own healthy cholesterol levels throughout life. So this cholesterol that's in the colostrum, make sure that that happens. So breastfed individuals are much less likely to develop atherosclerotic plaques in adulthood. We know that from research. So the other thing that colostrum does is help with expulsion of meconium. And then, of course, then that will help them to establish the bifidus flora in the gut. We think that meconium contains an essential growth factor for Lactobacillus bifidus, which is actually the first culture medium in what would have been before that the sterile lumen of the gut. And it may surprise you to know that there are actually a lot of bacteria in human milk. It's not a sterile fluid. In fact, we know now that there's about 700 species of different bacteria in human milk, and that's all about colonizing the baby's gut. And the third most abundant solid component in colostrum are these special sugars. They're called human milk oligosaccharides, HMOs. We know from research that there's about 200 of them. They're unique to human milk. No other milks have these. And this food is not for the baby. It's merely for the bacteria that's in the gut. So the HMOs feed the bacteria and help to establish a really healthy microbiome. So each mother's HMOs are quite unique, and they will match the kind of microbes that are going to be provided to the baby. So again, this is a very unique thing that happens between each mother and baby. So later on in breast milk, the HMOs are still there, helping, as I said, to colonize the gut. And what it does is educate the baby's immune system and helps to protect against allergy and some inflammatory diseases or autoimmune diseases especially. And we know that the spectrum is already present there antenatally at 19 weeks gestation. The concentration 7.5 milligrams per milliliter. By 30 weeks gestation, that's gone up to 12.5. And then after birth, it settles and it stays at a maintenance level of about 5 milligrams per milliliter for the whole of the lactation. So the other thing about the bifidobacteria is that, it's important to feed lots, to give lots of milk, lots of colostrum, keep the baby hydrated. And the more suckling that carries on at the breast in those first few days optimizes prolactin receptors. So that needs to happen in order for the mother to make lots of milk. Also to help clear the meconium. And then there's a connection between the gut and the liver, which helps to protect the baby against jaundice in those early days. So the more hydrated the baby is at the breast, so the more short breastfeeds that happens, that's going to help with protecting against the physiologic jaundice that some babies get. So what else is important? So when the baby then goes on, to have mature milk and to feed, and anthropologists tell us that primates lactate for 6 times the gestation rate. So in humans, that's like 54 months, 4 years. That's, you probably think, oh my goodness. But we know from research that when babies are fed for an extended amount of time, they're going to have all of these things are going to be something that's going to be important. They're going to have less diarrhea. They're going to have fewer respiratory infections. They're protected against meningitis, ear infections. If they're not being breastfed, the allergies will increase. They're more at risk for SIDS if they're not breastfed. Going to have some chronic digestive disorders down the track and dental and orthopedic things because of the I should put orthodontal. Excuse me, I'll have to fix that. So the shape of the palate is really more physiologic because of the suckling action of the baby. Less likely to have diabetes later on. And as I've said before, cholesterol issues, brain development, is optimal. And babies who are really preemie are protected against necrotizing enterocolitis. So that's quite a list. And it's important to kind of look at all of that and look at the big picture and know that it's not just about those early days. There is a continuing commitment to actually, to make the baby as healthy as possible. And of course, it benefits mothers too. I mean, in that early postpartum period, you get an increase of oxytocin, invites the uterus, promotes bonding. You get lots of prolactin levels, stops your menses from returning too early. And, it makes for good child spacing, fewer pregnancies, reduces risk of osteoporosis, and can protect against ovarian cancer in premenopausal women and against breast cancer. That's because of the particular component in breast milk that they've called Hamlet, human alpha-lactalbumin made lethal to tumor cells. So it's a combination of alpha-lactalbumin and oleic acid. And we know that breastfeeding is very protective against cancer. And so just for that reason is to be recommended. Now, in the next section, I'm going to look more at, very practical ways. But before I do, I want to just touch on some of the things that have been going on in the last 5 years that I think as clinicians we need to be educating, because everybody's been very gaslit. And a lot of mothers now are thinking that unless they get some sort of inoculation, they're not going to have any protection for their babies, which is not true. And when it comes to RSV, we know from research, so this research was done in 2022, it was a meta-analysis of 42 studies, only 2 deaths in children under 5 years of age from RSV. And that's because the really high levels of secretory IgA in human milk, remember I said they're 5 times higher than in serum, protect the baby's oral mucosa and nasal mucosa. And so the babies are not at high risk for RSV. So why is it being touted? Well, it's actually connected to the COVID story. I mean, that was a time when there was high anxiety. There was development of product that was very lucrative. And AstraZeneca was told to withdraw theirs. And of course, it's all starting to wind down now. And so there's been, emphasis on research to find something to fill that market, if you like. And so the production of monoclonal antibodies treatment for RSV was in the focus. So AstraZeneca were the first ones to develop one of those inoculations, and they called it Beyfortus. That's it there, Nirsevimab. So at the end of 2023 in France, they did a big 3-month clinical trial. 200,000 newborn babies were injected on day 2 postpartum. And during that time, the neonatal death rate increased 50%. That's quite considerate, yeah? So there's a big question mark over that, whether it's a good idea. So there's been some other studies coming out. This one, September 24. So what they're finding is that if they're treated with this vaccine, well, it's not really a vaccine. It's a monoclonal antibody treatment. They actually do have higher mortality rates than those who were treated differently or with a placebo. So this was a Japanese study, and what they did, they reanalyzed the clinical trial data that they used to justify bringing this to market. And they found that the study found that babies treated had a higher mortality rate, most likely linked to adverse effects from the drug itself, including thrombosis. So that's actually quite serious. And then in December 2024, the FDA's advisory committee met to discuss a way forward because they were doing some trials with RSV, and they had to put them on hold because the Moderna trial showed several severe side effects in their phase 1. And there was this increased incidence of VAERD, which is vaccine-associated enhanced respiratory disease. It occurred in 12.5% of the trial participants, so that's quite a lot. So what is VAERD? It's a phenomenon that occurs when vaccination promotes immune responses that exacerbate the disease, caused by the subsequent infection with the pathogen, and the vaccine was meant to protect against it. So it's quite a perverse situation. So, it's a big lucrative market. It's a watch this space situation. But if mothers are breastfeeding, as clinicians, you can reassure them that the secretory IgA in their milk is going to be protective for their bubby, and there really is no need to entertain a vaccine for RSV. In fact, human milk is protective against all viruses. And even in a dynamic way, if a mother gets sick and immediately her milk and the baby's saliva, they will, especially if the baby is then exposed to the same virus, the baby's saliva will inoculate the breast, and the breast gets the message that it needs to actually up antibodies in a certain area, and then the milk will change and the baby is protected. So that's a very dynamic situation, which makes it even more special. So recently, this is very, very recently, they've done this other study, and again, it's back in Pfizer. They're saying that women, so they're not so much vaccinating the babies, they're now turning their attention to mothers and saying to mothers, well, if you have the vaccine, you're going to be able to protect your baby. And mothers are buying into that when really it's all about the secretory IgA in the milk that's going to protect the baby. But anyway, so women are now rolling up their sleeve, and they found that 29% of them are going to have more hypertensive disorders needing hospitalization. And these include preeclampsia, eclampsia, and a HELLP syndrome, which is, life-threatening liver situation. And there's a statistically significant signal for premature and pre-labor rupture of membranes when women have had this vaccine. So that's the study there, if you want to go and have a look at it. And then, of course, we've got COVID-19, which is the other big elephant in the room. And it's such a lot of watch this space, so much unknown territory. And it breaks my heart as a lactation consultant when I always say that breast milk is the gold standard, it's the best thing to give. And yet we know from women who have had the vaccine that things are not so straightforward. And we're not going to know what's the best advice to give. I would still say breastfeed, but working on detoxifying spike proteins got to be a high priority. So when COVID first, was on the horizon at the end of 2020, there was a pilot study done in New York where they analyzed some samples, and these are from women who actually contracted COVID and got over it, and they found that they had an antibody in their milk that was specific for the illness. So that was really encouraging. And they said that we really need to do more ongoing studies. And on the strength of that, the Dutch government actually got women, thousands of them, to donate their milk, women who had had COVID and got over it if they were breastfeeding. And they were making ice cream out of it for the care homes for the elderly to try and protect them against COVID. So how sweet is that? But of course, that all got swept under the rug. And so they rolled out the inoculation and everyone rolled out their sleeve. And you say, well, what's in this thing? I mean, this is a study that came on my desk very early on. So September 2021 was done by in immunobiology is the name of the journal. This researcher was trying to find out, what's actually in the spike protein. So, that might lead us to develop a vaccine. And what they found was that there were a lot of things in it that actually you shake your head about. And I'm just going to list them here without making any comment. I think you can just read them and think, oh my goodness. And this is why when we homeopaths got together, we could not find a genus epidemicus. It's why when people come in with COVID, we have to keep changing remedies, and not everybody gets the same remedy because of this whole variety of components that are in the spike protein. This one is particularly scary, yeah? And of course, the parasites that are in it respond to ivermectin and it was banned. Everybody's getting influenza virus A. It's big in our community now from shedding. And we know it's a patented product, yeah, I've said. So we know from further scientific investigation that there are a lot of excipients that are in the vaccine that are actually not healthy. 11 heavy metals, I've got them listed there, and a lot of them are the lanthanides. And there are lesser known heavy metals, but all of them are known to be quite toxic. So it's not a to be taken lightly experience, having this vaccine. So there was specific research done in the breastfeeding space, and that was in September 2022. And they found that within 1 hour after vaccination, it was in the breast milk. Yeah. So they think that that was carried by the lipid nanoparticles that they put in it, which is polyethylene glycol. And it really accumulates in lots of organs, especially with boosters. So there was another report came out that was done by Pfizer, and lots of disturbing data, even though, the CDC overlooked that and they still approved it. They looked at 673 cases, 458 of them were during pregnancy, 215 during breastfeeding, and more than half of them showed adverse events. These were by the transmammary route, up to 20% of them. The facial paralysis, lymphadenopathy, blurred vision, and plus a whole host of others. And Naomi Wolf is all over it. If you want to follow her, get more information. And she's actually written a book about it. So, my final thought about that is we don't know what the sequelae of this is. So we need to just support mothers, help them to be as healthy as they can and to continue their breastfeeding. But to say, look, getting boosters is not a really good idea. Okay, so let's move on to the engorgement. So we need to assess breast elasticity, encourage lymph draining, make good use of that first golden hour, encourage lots of early feeds often because that optimizes the prolactin receptors. Now, this is what engorgement can look like. That's when the nipple would actually disappear. You can see that there's a little bead of milk here. She's actually dripping milk, and the baby would not be able to get on. So cold compresses helps, pump to soften the areola, gentle sweeping of the breast during feeds. An Epsom salt soak is excellent in a bath or in a big dish, a big handful of Epsom salts, because it will attract water to itself. And if the breast is caked, the breast will start to flow, and you haven't stimulated the nipple, which is really important. Vital lacquer, 200C 3 times a day. Optimal because of all of the lymphatic cells that are, and ducts that are involved around that chest area. And a lot of the blood that's going down to, feed the placenta reroutes itself to the breast. And so you've got a lot of blood, then you've got the milk coming in, and you get all this lymphatic stasis, and that's why Vitalac is really good. So if it's engorged, you can get painful nipples. So it's really good to check attachment, check for a tongue tie, encourage lots of different feeding positions. I think sending to an osteopath is a really good idea. And if things aren't going well, baby can't attach, a short-term use of a nipple shield is good. And that's an example of one. That's the sombrero one. But the thing about this is this baby is not attached well. Ideally, the center of the breast, you should be able to draw a straight line down to the center of the baby's head. This baby is much better. Yeah? It's a different nipple shield. So just going back to the one before, because of this baby's position, this area of the breast is not being drained well, and she actually developed an abscess in that area, that mother. So the baby has to have a wide gape, lips are flanged out, so the baby can take a good mouthful of the nipple and the areola. So when the baby is put on the mother's abdomen after birth, the baby has creeping, crawling reflexes and has this instinct because of the high adrenaline to look for a substitute for the placenta. And a well baby, a non-drugged baby, will in that first hour find its way to the breast. And so the mother and the baby should be in what's called the on-face position. And as I said, the crown of the head should be direct line in the center of the breast. And that's a good example of it. See that center? Yeah, beautiful attachment, lovely wide flanging. This not so much. See, this baby is not on, this baby's head should be down here. Yeah. This baby is really good. See, you get that lovely wide flange, lovely positioning. So what happens when the baby's got good connection like that? There's no tension in the breast, and the lots of pillows will help the mother. Pillows behind her back, pillows under the baby, just maybe moving the baby's body around a little bit. You have every mother's different because every mother's breasts are different shape. This one here, you can see this mother's tucked her baby up under her arm, and so she's got lovely, lovely positioning, and she supported the baby on a pillow. This baby's not good, okay? So this baby's head should be down around here. Yeah, lovely photo, but bad positioning. This is for when a mother has got a really fast flow. The baby can be kind of a bit more upright. The baby will actually come off the breast if it's coming too fast. But again, you get this lovely connection that's quite straight, and you get a lot of pillows to support the baby's back. It's a good feeding position. In an older baby, you know, they can actually lie on top of you like that quite easily. The bad thing about this photo is this bra. These kind of tight bras can lead to mastitis. If she misses a feed, that tightness and really thin straps can cause stasis in the breast, and she could end up with mastitis. So this is really lovely. That shows you beautiful, but this one's not so good. Yeah. But of course, with twins, you know, they're swapping sides all the time. I don't see that as an ongoing issue. But it does show you that there can be a difference. But then, of course, when they're older and they just want to touch base, any position doesn't really matter. That little fellow is just, for some reason, just wanting a little bit of comfort. So he's gone to mum. So the other thing is to look at is the blisters. It's normal to have a little bit of a blister in that early week. But then if it's really quite extensive, it means that the latch is quite shallow. There might be a tongue tie, and that's what a tongue tie looks like. That will have to be snipped. So you can see there's a bow, like a little heart shape, and that tongue is not able to come down, and that will cause trauma. So when the baby comes off, the nipple should look relaxed, not too stretched. If the baby's feeding and the lips are prissy, the cheeks are sucked in, you know that the nipple's not sitting back far enough. Good to check the baby's mouth for thrush, because if the baby's mouth is sore, they're not going to attach properly. And they'll probably click when they're feeding, and that's what they're doing, is they're using the back of the tongue to scratch the back of the palate. So that's when you might use borax or Halonius for the mother. So this is what's happening. This was this research that was done a long time ago, back in the late 80s, mid 80s, by Michael Woodridge. And so it shows you where the nipple sits at that junction of the hard and the soft palate. And it's actually the tongue and the movement of the tongue. You can see it here. This was all done by radiology, ultrasound. Okay. So it's the tongue and the working of the tongue that actually strips the milk. So the baby's not sucking milk out like as if it's a straw. It's actually suckling and using the tongue to do that. So it's really good to encourage non-bra days, fresh air, sunshine, get the nipples ready. If there is some irritation, a tea strainer that's padded can keep air around the nipple, which is good. Always keep in the back of your mind discreetly if there's some trouble with latch or sensitivity of the nipple, that there may have been a history of sexual abuse. So you just need to work your way around that and hold the space for that mother. So as I said, you've got to check for tongue tie. It's a sign perhaps that there wasn't enough folinic acid at the time of conception in a midline abnormality. So you've got to encourage appropriate detachment by mother to break the suction at the side with a little finger in the corner of the mouth. Don't try and pull off. So then look at the compression strip. It should be even. If it's wedge shaped like a lipstick, you know that there's either been too much of the top or too much of the bottom, and you just need to adjust that. So you've got to then treat the nipples, you know. Are they bleeding? Are they cracked? If it's a crack across the crown, it's more likely to be sepia. If it's at the base, it's going to be sulfur. So that's a sepia crack. There's some subrubrics, some borax we often use, sulfur, mantless, castor equi, causticum. And it's usually a matter that there's been not enough zinc, and that zinc's really important early in the lactation because it's low at term of birth because copper is high, and when mothers have got poor appetite, poor memory, depressed, low immunity, white spots, stretch marks, all of that sign of lack of zinc, and it's a cofactor for lactase enzyme for helping bubbies to digest the sugar of milk, and so keeps colic at not in the frame. Very important to get zinc up. So these are your zinc-rich foods, which are to be encouraged. And I always say to mums, try and have seafood every day if you can for lunch. It's a good set of zinc, protein, and the lovely long-chain fatty acids. So these are all the medicines that we would use if you look it up. Now, I'm just going to give a word of caution about castor equi and silica. While they can suppress a crack and heal it, often the reason why it occurred is not dealt with. And so you end up with an abscess. I've seen it happen. So you've got to look at the big picture. Don't be just kind of generic about cracked nipples. Take the case, find out what's going on. Because often there's more deep-seated things going on that you need to address because law of cure says that the breakdown of the nipple is going to happen as you're healing what's deeper in the breast, and the milk would be doing that. So don't be generic, okay? I'm just giving you a word of caution there. So if the mother can coat the nipple with some of her express breast milk in between feeds, it's good. Always check that the pads don't stick. So if she's using nursing pads, to actually squeeze a bit of milk into the pads to make it soppy, and then it should just come off easily without taking any skin off the tip of the nipple. You can make lotions of calendula, hydrastis, or hypericum if there's a lot of nerve pain. And hydrous lanolin, to which you add some calendula, is really, really a good way because that's moist healing, and the epithelial growth factors that are in human milk will help that. So I know that looks terrible, but once the nipple is in and it's stretched out, it's the tongue underneath really pressing on the areola, so the nipple doesn't really come into play. You could get herpes. You can cover that up. Low arginine diet's important if there's herpes. Get L-lysine up, 1,500 milligrams a day. Dairy is a good source of L-lysine if it's tolerated, suggest that. It could be dermatitis. If it's red and sore, it will be itchy, flaky. Maybe Halonius might be what you might look at. So check for dietary triggers and environmental triggers such as soaps. You might need to look at that. But a sensitive nipple could maybe be that the mother's pregnant again. I've diagnosed a lot of pregnancies in my time. Unfortunately, in some women, particularly tubercular women, they will often ovulate before that first period, which is a bit unfair. There's a thing called Paget's disease. I'm just mentioning it. It's not likely during lactation because it usually happens in an older mother, but there's usually a history of cancer. So if the nipples are bleeding, it might be because the child has bitten the mother, and that can be a sign that the baby's sensitive to cow's milk in her diet, because when cow's milk is going through the milk, the baby is not able to suck and breathe and swallow all at the same time, and so we'll pause to be able to take a breath, and so we'll actually bite down. So, and I know that hurts, but I say to the mothers, just roll the baby so he can't breathe, and then he'll drop off anyway and cry. And then you go, oh, you poor thing. And the baby then sort of learns that he's doing it, it's not anything to do with the mother. So you got to give them tuberculinum and get all the dairy out. But make sure the mother has 1,200 milligrams a day of a calcium supplement. That's really important because it's a cofactor for making the milk. But if you've got frank blood in the breast milk, it means that there's papilloma of the ducts. So look for a history of skin tags, especially in the pregnancy, and warts, nipples on Morgan, Gertner, and Thuya. And I've got a case on my website. I didn't published articles about that. First case I ever published was a woman I treated with that. It was really interesting. I learnt a lot. So the last word is that, as I said to you before, the baby's saliva will go through the Montgomery's tubercles and keep the breast informed about the situation of the baby's health. And if the mother needs to be making specific antibodies, her breast will do that. So looking at low supply, is the letdown working? Well, it all comes down to this. So you've got your pituitary, and so when the baby starts to suckle, goes up and a message goes to the anterior part, which makes a prolactin, comes down, and the alveoli start to make the milk. After a few minutes, the message goes back to the posterior part, and that kicks up the oxytocin, which causes the letdown. Now, each alveolus has a network of veins and arteries, but it has these muscle cells all around it called myoepithelial cells, and the oxytocin reacts with those and squeezes them and causes the milk to eject. It's an ejaculation of type, if you like. This is like this. Yeah, it's a pulsatile thing. And the mother will get several letdowns during the feed, which will keep the milk flowing. And then you can see how the milk cell works. Yeah, gets quite active. Haven't got time to go into all of that. So mothers will feel it individually. Sometimes it's a turgescence or a flush of heat or the other breast drips. The baby's pattern of sucking changes. They'll be fluttering, and then all of a sudden they get these deep drafts and the ears wiggle. You've got to look for the wiggle in the ears. What can impede the letdown? Well, pain, back injuries, scoliosis, history of surgery, transgenerational trauma might be involved. You could consider that. Lack of trust with care providers in the clinical setting might also be a factor. Lack of privacy, lack of confidence, lack of comfort during, you've got to get a routine going. So, if it's time for a feed, you have your favorite chair, put on your favorite music, get something to drink, and as you're going through all of those things, the breast will already begin to start to let down because of the familiarity of the routine. So if the mother is stressed, she's going to be producing a lot of cortisol, and that causes contraction, which is a different thing from, a calm situation where you're going to have lots of oxytocin, which is what, will cause the contraction of the alveoli and for the milk to flow. It's important. So is the supply low? That's something a lot of mothers worry about. But the thing is, in the early days, newborns don't need very much, At birth, that's how big their stomach is, it starts to increase, as the days go along. But right up, colostrum is enough for them. You got to check the vital signs. Weight checks is good. But, just think of a monthly average is better, because if bub's teething, there could be issues. About 5 ounces a week or 150 grams is important. Cluster feeding will often occur around growth spurts, so go with that. 6 to 8 wet nappies a day is important. Maybe once a day a dirty nappy, but sometimes even once a week, and that's considered normal. Little like the consistency and colour of pumpkin soup, that's good. But if there's mucus, it means that the villi is shedding, and that means that there's a lactose issue. Is the baby content? Now, this lady called Priscilla Dunstan, and that's her website there, has identified that there are certain sounds that the baby makes that will help you to understand. And I must say that over the years, I've come to recognize them. And so in the clinic, if the baby's making certain sounds, I'll say, no, it needs a burp. No, maybe you do need to put it on. So, you can learn these over time. And just remember that, don't be obsessive about it as long as the baby is continuing to put on weight. Some babies are slow gainers, some are fast gainers, but you need to keep an eye on it. And if the baby is going backwards, it's maybe got nothing to do with the mother's supply. It might be something to do with the baby, that there may be an atresia or something, some internal error of metabolism or organ development that needs prompt attention. So a good pediatric check is something that must be done if the baby really is struggling. It's not to be ignored. So another tip is, a hungry baby's doing this, whereas a full baby's got a relaxed hand. So a baby with a poor suck, can often cause undersupply because they're not stimulating the breasts enough. So sometimes those babies do need silica or sunicular, and that will really wake them up and make them more vigorous, and then they'll make more milk. The other thing is that the mother lost a lot of blood at birth. That affects the circle of Willis, and that can impact on supply. So you've got to get lots of hydration in the mix, a lot of iron-rich foods in the mix, and know that it will take several weeks, but you can recover. So, but there could be an emotional basis, and you could look at asafoetida. So don't dismiss that. Are there bottles of water being used? Is formula being used? Using the dummy. Nipple shield can, over long-term use, is not good. It can reduce the amount of milk baby's getting. There may be retained products, so the Agnes Castor. So, ask about the lochia. Has the mother gone on the pill? Is she perhaps pregnant? So those things will cause supply to drop. Has she had breast surgery? What sort of surgery did she have? If the nipple was cut out,
Yeah,
that's
Patricia,
really
sorry, the translator asked for slow down a little bit. Can you please?
okay. I'm just worried about time.
You have 4 minutes. Or, yeah, you have 4 minutes. Go for that. What
Can you,
happened?
can you hear me?
Yes, yes.
Yeah, I can proceed?
You have 3 minutes
Yeah.
more. You have,
Okay.
I'm
All
I'm
right.
checking if Dr. Ashok Borkar came or not, or if there are any questions, you can ask
Sure.
Patricia.
So breast surgery, scoliosis are also to be considered below supply, and also about when did you start using the pill. If girls start on the pill when they're teenagers, they can often, the interference of the artificial progesterone can really impact on the development of the alveoli, and that can cause the mother to not have enough breast tissue to produce milk when she's pregnant. The other thing, alcohol and tobacco consumption, it could be a problem. So the vena sativa will help. Check hydration, prescribe medication or herbs, and her stress levels. Also ask about thyroid. Is there any problem in the family? Because that will impact on supply. And so will diabetes. Plenty of protein in the diet. The one thing that Ricinus communis used as castor oil as a rub on the breast can increase supply. But remedies, unless it's causticum, if a mother has had ailments from night watching, that can really be a big thing to consider if the supply is really low. But sometimes it could be lacumanum, if she's got some psychological issues. But there are a lot of remedies that we consider to use, and laculinum can be one that can be used. A laculinum mother's breast looks like a dog dug. That's one of the things that we can help you decide. All right, we'll see. Is there any other questions?
Patricia, we are waiting for Dr. Ashok Borkar. In between,
Alrighty.
if you have something in mind
No,
to
no, that's
say
all
in the
very good.
next
Thanks very
2
much.
minutes,
I'll
let me
connect
know.
back in to listen. Talk to you later. Bye-bye.
Bye-bye. Thank you very much. It was amazing lecture.
Thank you.